Screening, how you can screen for autonomic dysreflexia. Talk with your patients. Ask patients about symptoms. As I mentioned to you, do 24 hours blood pressure monitoring. This will help you to see both low and high blood pressure. Be aware about the level and severity of spinal cord injury, because this will help you already to recognize if person have high thoracic or cervical level of injury. Most likely he is predisposed or she is predisposed to the developing of this condition. Document episodes of abnormal blood pressure. Document symptoms that patients will have during this episode. This also help you in the future to see how patient progressing. Screening, as we mentioned to you, be prepared that arterial resting blood pressure in person with cervical high thoracic level will be lower, not normal. And it's normal for them. That is, they will have going to work, doing exercise with sometimes arterial blood pressure 80/60. This is a typically low arterial blood pressure for high cervical individual. Increase of blood pressure by 20 millimeters of mercury will be abnormal for them. And we do see that sometimes patients coming to our office and complaining on headache and sweating with their blood pressure 130, 135. Because their normal blood pressure is 80, they are in episodes of autonomic dysreflexia. If you can have test in a laboratory if patient has possibility to stand up or not, then do sit-up test in your office, easy to do. And then, of course, you can sometimes simulate various conditions with a cautious. For example, ask person to drink a little bit more water and see how their blood pressure responds with the over-distended bladder. But be ready to immediately take appropriate actions. What to do when you don't know what to do with a person with spinal cord injury. If person in acute episodes of autonomic dysreflexia and you cannot control arterial blood pressure, send them to emergency. We do know that sometimes we have to introduce big guns to manage arterial blood pressure in people with spinal cord injury with IV infusion of antihypertensive agents. Do aware that episodes of autonomic dysreflexia can occur multiple times per day due to various stimulations and so on. Very unique aspects. If you have a woman with spinal cord injury, be prepared that during the pregnancy period time or delivery, women with spinal cord injury with high cervical mid-thoracic level also predisposed to significant elevation in arterial blood pressure due to uterine contraction, and this has to be prepared and managed. And by international guidelines of management of pregnancy and delivery in women with spinal cord injury, spinal anesthesia actually considered as the best practices. Be also aware you cannot do any surgical intervention in a person with spinal cord injury below the level of injury without proper anesthesia. Yes, they don't have any sensation, but any surgical, even minor surgical procedure could trigger episodes of autonomic dysreflexia because this will activate sympathetic nervous system and result in a massive elevation of arterial blood pressure.
I was just wondering, in order to establish baseline, how often should someone be checking their blood pressure regularly? Multiple times on a daily basis, and then maybe once it's established, then not so often? Or I don't know. I just wanted to know what you would think is a good maintenance check.
Very good question. For many of patients who discharge from J.F. Strong Hospital from acute period, I will recommend to have blood pressure machine at home. Very frequently, I will write them prescriptions that this blood pressure machine will be covered by insurance. First of all, when you develop symptoms, I ask my patients, when you develop symptoms, we became lightheaded or headache or sweating, measure your blood pressure, document it, and then let's discuss it in my office. I also recommend to measure blood pressure initially when they're adapting to their new environment at home after the hospital. When you're doing bowel routine, measure blood pressure before bowel routine and immediately bowel routine, that we will understand how high arterial blood pressure will go. I also will ask my patients sometimes monitor blood pressure after sexual activities at home. Then we will know how high arterial blood pressure happening. And then based on these recordings, that's a typically 3 to 4 times a day for a couple days in a row. And then they're coming back to my office and we discuss what to do and how to manage these issues. But then it has to be decreased. We don't need to measure it every day, 4 times per day. Mostly initially to understand where they're standing with blood pressure. Or 24 hours blood pressure monitoring will give you many answers immediately.